So back to this intro after a little hiccup. Can got his computer science degree from Carnegie, well, PhD, I should say, from Carnegie Mellon, little university you've probably heard of. He also then went and worked for Oracle as a database engineer for 6 years, and then he left Oracle and went back home to China, where he was working for the Chinese equivalent of Google, Baidu, if I'm saying it correctly. You can tell me.
Yeah,
And then about 5 years ago, he said, hey, you know what? I'm tired of working on this core business with Baidu and making all this insane, making all this progress with the search. I want to go and start my own thing. I want to create a startup around healthcare. And so that's what you did. You're doing healthcare and ML. And today you're going to talk to us about the practice of machine learning and medicine in China during COVID. So without further ado, take it away.
Okay, thank you. Hi, everybody over there. This is Ken. I'm talking to you from China. And today, my topic is the practice of AI doctors in China, especially in the time of coronavirus. You can see the picture of the background. That is something called cabin hospital. We construct such kind of cabin hospital in only 3 days, capable of dealing with more than 300 patients. Even though it's kind of fast to construct a hospital facility, we need doctors. So our solution is to borrow doctors from other cities. Now the question is, the local people of the other cities also need doctors. So that is a very huge challenge because it is a big shortage of doctors, especially in the crisis of coronavirus. Solution number one, we can enlarge the medical school to train doctors. Now the question is, the cost is high, the time is long, the quality is not guaranteed. Therefore, we have to think outside the box. So let's think about Starbucks coffee. So we have a lot of Starbucks coffee shop in almost every corner in the world. And the myth, the miracle is that the quality of Starbucks coffee is very consistent, even though it is in a very remote corner of the world. How can they make it? 2 secrets. Number one is the machine. Starbucks coffee machine is highly automatic. Therefore, they don't need very skillful human roasters. The human roaster's job is only to push the button, which is very simple. The second secret is that they have a very reliable supply chain. Therefore, they can guarantee the quality of the coffee beans for the Starbucks, every store over there. Now, if we want to apply the same idea from the Starbucks to clinics, one huge challenge is that how can we handle something called the individual differences for the patients? Meaning that every patient, not only they may have different diseases, but also their status are different. That is called individual differences. Even though the diagnosis results and the treatments are different, the principle, the methodology behind the diagnosis process and the treatments are almost the same, very stable. In our term, the algorithm is the same for every patient. So let's go to the technique in more details. Actually, it's not so complicated, which consists of 4 steps. I worked with Chinese version of Google, which is a search engine company called Baidu. So we applying the search engine technology to hundreds of hospitals in China. Therefore, we have the opportunity to process almost 800 million medical records in China, which covers more than 200 million patients over there. The beauty of our technique is that it only costs us 3 weeks to make the job done without any on-site engineer, so that our cost is really low. That's the first step. The second step here is more difficult. We want to transform every medical record into a sequence of key and value pairs, which is called real-world clinical routes, so that 800 million medical records, in our point of view, is 800 real-world routes, okay, of a sequence of key and value pairs. This sequence of key and value pairs are very important because when we look into the different key values in the same sequence, if there is one key value which is the outlier, means that it's inconsistent with other key and values, it implies this key may be a mistake or even a fraud. That is the trick. That is the principle for us to look into, for us to implement the quality control and the cost control. So that is the second step. As we mentioned just now, we have 800 million medical records, which is 800 million routes. If we compress this 800 million routes together into one page, we will get something like a map, or technically it is called graph of knowledge graph. The graph consists of nodes and the edge between the nodes. But unlike the traditional graph, our medical graph is very unique. It has something called a hypernode. It means a combination of multiple nodes working together or fail. So we call this one hypernode, a group of nodes working together. The second one is trickier. Means that usually the traditional graph, there is a weight on every edge connecting two nodes. Usually the weight of the edge is a constant, means stable all the time. But in our scenario, the weight of the medical graph is changing, is dynamic, and also is nonlinear. Therefore, we cannot put a number over there. We need a model over there, dynamically decide what is the value of the weight from time to time differently. So that is a cutting edge technology. We call this one deep medical knowledge graph. With this map or with this graph, we can do the navigation from the starting point to the destination. So in our scenario, which is based on the current situation of the health status of the patient, we should decide what is the best action for the next move, which is very similar to AlphaGo, which is defined by the DeepMind of Google. So we are using the same principle, same algorithm, which is called a deep reinforcement learning, to decide what is the best move for the next step. So with these four steps, the first one is a search engine. The second one, we transform each route, each medical record into a route. The third step is we compress this 800 medical records, or the 800 million routes together into a graph of medical knowledge graph, a map. Then the first step, based on the map, we can do the navigation, reinforcement learning. So combining these 4 steps together, we have a system for the AI doctors. Now, the next question is that how can you turn an algorithm to an entire system of an AI clinic? The idea is very similar to construct a car. The algorithm of the AI doctor is something like an engine or a chassis for a car. And above it, we can integrate to different devices so that we can have the whole set of the AI clinic. There are many different kinds of cars, okay, with different price and different functionality. In our version, we only focus on the common diseases. In China, the government defined 387 diseases as the common diseases. The reason we choose to deal with the common disease is that technically it is easier, and the market is huge. Even though we only deal with 800 and 300 diseases, it almost covered 90% of the medical cases. It means a huge market for that. In terms of quality, comparing with the human doctors, the quality of our service is consistent and very competitive with above the average level of the human doctors, which is kind of satisfying. For this 300 common diseases, we don't need too many devices, so that when we integrate all those different devices into the chassis or the algorithm, the job is not so challenging. The outlook of the product consists of 3 parts or 3 tiers. The first one is the supervision tier. The purpose of the supervision tier is to guarantee the quality of the service, to control the cost, so that we can make sure that the patient get a very good service. The second tier is for the doctor's tier. The main functionality over there is to a step-by-step guidance, so that to make the job of the doctor and the nurse easier with a good quality. The third one is for the patient. The main purpose over there is the communication. Whenever the patient have questions, they can ask the questions to the doctors and get the immediate reply. Of these 3 parts, the most difficult one is the doctor's version. Doctor's version consists of 4 functions. Number 1 is the advisor. So we break the whole workflow of a clinic into several steps, and we make every step very automatic so that the doctors and the nurse's job are very easy. The minimal size of the clinic only need 2 people, 1 doctor, 1 nurse. We push this product into more than 2,000 village clinics, and it works fine. The second part of this one is that we're using IoT technology, Internet of Things, to integrate all those medical devices so that we can collect data from these devices automatically without the human labors, so that make the job of the doctors and the nurses of the clinic easier and reliably. The outlook of the advisor is something similar to a recommendation system. So on the left side, when the doctor input information of the patient, especially the information of the diagnosis process and the treatment, including the prescription, doctors do not need to follow the instruction. However, if they want to make their own decision, on the right side, we will give them a warning of 3 different colors. The red color means you are making a mistake. You ought to change it. Okay, this orange color, it means that we strongly suggest you to change your mind. If you don't, you may get a ruin of your credibility. The third one is a yellow color. It means that we are kind of suspicious. We suggest you to think it over, but you stick to your own mind, it's fine. You will not get any penalty. So on the right side, that is the recommendation system, give you step-by-step guidance, or give you 3 levels of warning. That is called a clinical advisor. The second functionality is called a pharmacist assistant. So it's focusing on the prescription. The main job over there is to verify every drug in the prescription with the regulation. If it's not, then we'll give you a strong warning saying that you cannot using this drug not only accurately, but also economic. Give you a cheap drug, but with good effectiveness. This is called a pharmacist assistant. The third one is this. Even though we try to build up a very powerful algorithm to cover almost every common disease, still we have some corner cases that we are not confident. In this scenario, if we are not very confident, we ask for help. We ask help from the remote good doctors. This is called a remote diagnosis. so that we guarantee we will not make any stupid mistake for the AI clinic. The last one is between the clinic and the hospital. We need an ambulance. We need to construct a smart ambulance. Over there are 2 points. Number one is that we are applying 5G communication technology so that we can synchronize the information inside the ambulance to the emergency room of the hospital instantly, precisely, and easy to follow. The second one is that we are using AR and VR technology so that we can give the step-by-step guidance to the nurse inside the ambulance in time and very conveniently. So in summary, the doctor's tier consists of a workstation where the doctors can input the information for the diagnosis process, the treatment, everything into a medical record. The second part is a system. It's a recommendation system. It gives you step-by-step guidance with 3 levels of warning. And also we have remote diagnosis so that we can guarantee you cannot take any risk to risk the life of the patient. Also, we have a smart dictionary because sometimes you have to look into the document to look up something. Instead of looking into the dictionary document page by page and paragraph by paragraph, the smart dictionary can jump into the right paragraph with the right sentence exactly as you want. Then we briefly mentioned the patient tier, the patient version over there. As we mentioned just now, the purpose of the patient version is for the communication, so that the patient can ask questions to the doctors anytime they want. Now, the challenge is that the human doctors are not always available. We don't have so many human doctors and people need some rest. So that we need the algorithm. We need to train the machine to answer the common questions for the patient instead of bothering the human doctors. If we change the view angle, to the computer's architecture, so the system, the architecture of the AI clinic is very similar to the architecture of a computer. On the bottom is a data connection, collecting data from multiple resources with different formats, with different content. In the middle is a kernel. The purpose of the kernel is to transform the information from multiple resources with multiple formats, with multiple content into something standard, into a very well-structured, so that the machine, the computer, can process all this information automatically. So that with the help of this version of this kernel, on top is the application space. Over there, we have a lot of applications to supervise the quality of the diagnosis and the treatment, to supervise the cost, to supervise the conversation between the patient and the doctors, blah, blah, blah. So that we have, a lot of applications in the upper tier. We have done these things in this year. We have done tremendous work over there. And the first thing is that we have constructed the first online hospital in China, which is hosted in Guangdong Second General Hospital. And not only we serve one hospital, but also we serve more than 2,000 village clinics, which are connected to this, Guangdong Second General Hospital. And this is a very successful case, so that almost every day we serve more than 40,000 patients. So during the 4 years, we totally have served more than 17 million medical cases. It's a very busy business, very popular. The second case is that in February, in 1 month, we launched our system to more than 400 hospitals, bigger and small, in a lot of different countries, a lot of different cities, big cities also with the villages. More than 400 hospitals in one province, and this province is Jiangsu. This app can be downloaded from iPhone's App Store, so everybody can test it. And the miracle over there, finish this job in only 1 month, day and night, working really hard. The third one is for the smart ambulance. We launched this system to the second best hospital in China, which is in Chengdu, Sichuan. Over there, we are applying 5G communication technology so that the ambulance can, synchronize the information to the hospital instantly, precisely, and very conveniently. That's the first thing. The second thing in the ambulance is that we are using AR and VR so that the hospital sitting inside the Huaxi hospital can remote guide the nurse in the ambulance instantly and very easy to follow. That's the first part, pre-hospital parts. The second one is the in-hospital side. Over there are two purposes over there. The first one is to liberate the hands of doctors instead of asking them to type in too many information into the computer. The way we implement this one is that we are applying IoT technology. We have a lot of sensors, a lot of cameras, so that the doctors don't have to type in to the computer. That's the first one. Liberate the hands of the doctors. The second one is to be quick, to save time. Instead of typing line by line to the computer, to the medical record, our system recommend a whole package of the prescription, the whole package of the diagnosis result, so that the doctors can, the job of the doctors is to view the results quickly, to do some small change, then click the OK button. Then the job is done. We can save the time of the doctors almost 30%. The last case is kind of interesting. We are building AI clinic inside the jail. The reason is that it's kind of awkward to send the prisoner outside the jail. Therefore, we build in high-end AI clinic inside the jail. So far, we have construct more than 30 such kind of AI clinic inside the jail, the drug rehab, all those things in 3 provinces, in almost 6 or 7 cities. That's it. So the objective of our company is to dig medical records, especially millions of, so that we can clone the brain of doctors, of good doctors, so that we can solve the problem of the shortage of doctors, so that we can offer the good healthcare service everywhere in the country. That's it. Thank you.
All right. That was great. Very insightful. And we have a few questions coming up. If you allow me to ask, we have one from How, and they're asking, how does the key value pair assignment work in reality for different diseases or conditions? Can you give an example?
Can you repeat the question, because
Yeah.
the voice is a little bit low? Can you be a little bit louder? Thank you.
At the risk of yelling, how does the key value pair assignment work in reality for different diseases / conditions? Can you give an example?
Okay, so there are 2 things over there. The first thing is we're only focusing on 387 common diseases. Okay, so technically it is not so difficult. That's number one thing. The second thing is that whenever we realize there is a risk outside this common diseases, we just send this patient to the hospital instead of asking him staying with the clinic to risk his life. So Is that clear?
Yeah, great. That's very cool. So next question in the chat. There's some awesome questions for asking these. Keep them coming too. How do you deal with disease that never happened before? For example, if we apply this AI clinic at the early stage of COVID, we will not have enough training data. Then how can the clinic AI successfully distinguish COVID-19 from the common flu?
Okay, that's a very good question. So whenever our algorithm goes to give you the diagnosis results, not only the probability we're giving, but also something called a confidence interval. The confidence interval is a kind of a measurement of how many similar cases the model is trained on. So if we encounter a kind of a scared, kind of non-common diseases, we don't have too many medical records to train, then the confidence interval will be big, means that we are not so confident. If we are not so confident, we will send this patient to the remote hospital instead of asking to stay with our clinic. Is that clear?
Totally.
Good, very good question.
Yeah, and let us know. That was a question from Angelina. So Angelina, if it's not clear, give us a follow-up question. The next one's coming at us from Sean, and he wants to know, how was it validated that a red-orange rating given by the AI may be correct than a human doctor, maybe more correct than a human doctor? Thank you for the very interesting presentation.
Okay, so last one. Okay, this is good. This is a very interesting thing. So how can you distinguish the red from the orange from the yellow? Still, the confidence interval. Okay, if the confidence interval is large, means that we are not so confident, we go to orange. Okay, we allow the human doctors to make their own decision. On the other side, if the confidence is very narrow, means that our system, our AI algorithm is very confident to distinguish that the human doctors is making some mistake. Then we'll give you a red or a orange. Okay, it depends on the confidence interval. Thank you.
So this is a great question from Ming. Have you used the AI doctor for yourself?
Oh yeah, I try almost every day.
There we go. Nice. Next question from Manal. At what stage is this project in? Have any MVPs been developed, or is it still at the research stage?
No. It's a product. We have pushed this one to the market for more than 3 years. So more than 2,000 villages in China are using our system daily. Every day, they have more than 40,000 patients who use this system. And over this year, we have served how many people? Let's see. I have a number here. Okay, so we are helping more than 40,000 patients every day all over the China. And over these years, we have handled 17 million times in 4 years. So it's not a research, it's a real world to serve the real market. Thank you.
Wow. Fascinating. Okay, we've got a nice question from Mark here. How much and how fast was the requirement of engineering and doctors working together in China to produce hundreds or thousands of diagnostic healthcare medical equipment for deployment to make it push button capable to implement this solution in a record short time?
So the key point is that we have almost half of our development team are doctors. Like 40% of the development teams are doctors. So they are doing 3 jobs. The first one is to do the annotation of the medical records so that we can train the AI algorithm. So annotation, the first job. The second thing is to verify the quality of our algorithm to see whether or not our algorithm's result is okay or it is wrong. That's the second one. So QA, quality analysis. The third one is the launching one, is the maintenance. Even though we have the AI algorithm running every day to serve so many people, we have a team of doctors, human doctors, sit over there to look into almost every cases. Okay, so the job of this doctor team are three jobs. One, annotation. The second one is the quality analysis. The third one is monitoring. Thank you.
Excellent. Next up, how do you measure success or failure?
Okay, so we are doing something called the A/B test. A/B test. The A/B test seems that we go to a big hospital like Guangdong Second General Hospital. The patients visit the hospital. Just as usual, the human doctors, do the diagnosis and do the treatment. No AI, okay? No algorithm. It's just like the good old days. However, the same information go to our AI system. Our AI system will give the diagnosis results as well as the prescription. Then a human doctors come in to compare with the human doctor's results, meaning diagnosis and treatment, with the machine's result, diagnosis and the prescription, and compare these two results line by line. If the good doctor saying that machine is good, we think machine is good. So it means that the judge is a good doctor. Is that clear?
So, wow, there's some amazing questions in here. And if it's all right with you, can we keep going? I know we're 3 minutes over. Do you mind if we keep chugging along, because there's a lot of questions that are coming at it? Great. So we've got one here from Yuambo. To integrate the heterogeneous data sources, what are some clinical ontologies you are utilizing? With new terms from COVID-19, are those ontologies kept well up to date?
Okay, so we have new data almost every day, okay? Because our system is running every hundreds of hospitals, so that it is training, it's updating, it's upgrading our model every day, okay? And the model is interesting, especially for this common diseases. Not only we look into the similar cases, but also we are considering the time, meaning that yesterday we have seen so many people of the same diagnosis, then our algorithm will tune up itself by itself. We will give more concern on this disease because yesterday or the day before yesterday, we have seen so many cases. So in short, our algorithm is very smart. Not only taking the consideration of the similarity, but also the time and geographic location, meaning that, well, in Wuhan, we have seen so many such kind of diagnosis throughout. So that if there's another patient coming here and he's located located in Wuhan, we may consider this disease with higher weight.
Yeah,
am I clear?
makes complete sense.
Good, very good one.
So, do you think that AI doctors will completely replace actual doctors?
No, no. I'm not so confident. So far, we are handling with the outpatient, not inpatient. We are handling the common diseases, which are easy. but not something like cancer, like surgery, all those things. Maybe the next step is that we'll go to every individual departments to handle something more challenging one, okay, instead of the 800 common diseases. But that is the next one. In the long run, maybe for this 387 common diseases, the machine can be compatible with the human doctors. But for those difficult ones, like cancer, like bone, like I don't know, liver, blah blah, I'm not so confident. At least in the recent years, for 5 years or 10 years long, I cannot see any chance that the machine can completely replace human doctors. No, I'm not so confident.
Now,
yeah.
When you're building knowledge graphs, how do you filter valid data?
Okay, interesting. So we are building up two kinds of graphs, not only one. The first one is mentioned in the PPT. We are building up such kind of graph from the medical records. There are a lot of mistakes up there, okay? The second one is collecting manually from the documents, like a textbook or the clinical pathway, all those documents. Over there are more kind of rules, okay? So these are two kinds of graphs. And then we're combining them together so that we have a better graph. In the PPT, I didn't mention this because that is too much details over there. But this is a really good question.
Excellent. And now, what percentage of the technology solutions require for ambulatory care equipment were needed to be built from scratch in order to rapidly deploy this solution to treat patients in the different clinical settings in China, like a UI UX design for simple device interfaces driven by AI?
Mm-hmm. So that is two parts over there. We have a protocol, international protocol called HL7. It's not defined by Chinese people. It's defined maybe by American or European. We are following this protocol. So we are following this standard protocol so that we ask every manufacturer of every medical equipment to force the data in align with those formats. That makes our job much easier. That's number one thing. We are only using HL7 protocol and everybody using it so that we are talking in the same language. That's number one thing. The second thing is that in China, the ambulance, especially for the emergency, there are 4 kinds of diseases: chest, brain, especially for the stroke, like the bone, also the heart. Okay, so those are 4 special emergent, the healthcare diseases. We don't handle them. We are not curing them. We are only maintain the status. We are only doing some kind of initial step to get rid of the emergent, immediate danger. And we send this patient to the hospital as soon as possible. Okay, we have a very clear boundary. We are not curing them. We are only making it stable. Is that clear?
Yeah,
very good
that's
one.
A great point too. Very nice to hear you talk about that. So this is an interesting one. I think this is a great question. Manal asks, what about retention rate of patients? Are they returning back to use the service? And could that be considered an indicator for people trusting AI doctors?
Mm-hmm. So, well, this year's of coronavirus is a disaster. Okay, but also we can see more and more people relying on our AI system, especially during the time that everybody has to stay at home. It's not very convenient for them to visit the hospital. Therefore, they kind of, force to use the online healthcare service, meaning the AI algorithm. We can see the number of this, online consumer more and more almost every day. So, in short, more people are returning to our services.
All right. It looks like we've got one more coming, and it's from Wei asking, okay, do you think it will be possible to implement your tech in Canada due to privacy and the lackness of many sectors?
Yeah, of course. From day one, we are thinking this one not only a product for only
Oh,
China, it is an international product. Okay, so therefore we are very careful for the privacies. We are building this search engine inside the hospital with the private cloud, meaning that no medical record is taken outside. Every medical record is only used to train the model, to give the parameters of the model for the graph. Okay, the graph is nothing to do with every individual cases. It's just a statistical information. So that is okay to take that out to apply to other cities. Now the question is, when we apply the parameter of the model from China to North America, there will be one interesting thing because the status of the health status of the people in these two countries are fundamentally different. So that I'm kind of predicting that I can see that the diagnosis process and the treatment, especially prescription, might be different for the same disease, but for different residents in the different countries. That will be a very interesting question to answer. In short, we will apply this one to Canada and also other countries, not only China.
so
Great one. Thank you.
is your company gonna come and do it?
This year is kind of bad because we're kind of locked up in the country. It's not so free. It's kind of free to travel from city to city in China, but it's not so good, not so convenient to go abroad, especially so that this year is kind of hard for our progress of internationalization. But maybe next year will be better, I guess. I hope.
Well, Can, this has been an
Yeah.
amazing presentation. I really thank you for taking the time to answer every single one of these questions. It was brilliant, and it's obvious that you have some amazing experience under your belt. Thank you all for coming and watching this. We'll see you at the next session.